Three-day slopes. The best thing that modern medicine does is enhances there were dentures which were very difficult to handle. Cleanliness was a problem, maintaining them was a problem, and they never were like the permanent teeth a person was used to. Implants, dental implants, have changed the whole concept of permanent teeth. So we have the milk teeth, then the permanent teeth, and after the permanent teeth give way, we have implants which can be fitted within 3 days and can act as permanent normal teeth till the person dies. This concept had its roots in Europe, and during the last 15 to 20 years has spread around the world. And Dr. Stephen Ede is considered one of the pioneers both in designing as well as implanting the dental implants, both developing the material, designing it, and then implanting it. So keeping that in mind, having a permanent tooth just within 3 days of removing the earlier tooth, which has either lost its ability or has fallen off, is something very revolutionary. One thing it does is that the comfort level of the patient who is used to chewing with normal teeth is restored within 3 days. Earlier, it was about 1 year's time to take a new tooth out and complete an implant. So you can just imagine, from 1 year it came down to 3 months. From 3 months it has come down to 3 days. This is the kind of revolution we are speaking of. Today modern medicine lives on that. The reason that we have hospitals of this kind is to bring in that kind of technology with all the safeguards that are there, to give that quality of life to patients who seek to have a proper, good quality life. And it is not the most expensive of procedures. Earlier the costs were huge, now the costs have come down. So getting top level treatment equal to anything in the world at Indian prices is what this workshop is all about. And Olive is proud that it is doing this support activity for the dental. Going into details, but the good part is that it is near zero risk kind of a procedure. It's a near zero risk kind of a procedure. I'm using the word near zero is nobody becomes a God. A doctor is a doctor. He's a human being. Nobody can play God. So when I say it's near perfect, there is hardly any impact. That small area still remains of human error. But again, that is there for the most ordinary of surgeries. It's there for the most, even for tonsillitis operation, there is the small chance of a human error. That is there in implant system. Nothing special at all. Nearly a foolproof procedure. Yeah. Again, Dr. Irfan Motiwala will be answering that question in greater detail. This technology and technique which has been adapted by Dr. Irfan Motiwala along with Dr. Stephen Ede makes it possible for diabetic patients and patients on blood thinners to have implants. Earlier, it was impossible for diabetic patients as well as patients who were taking blood thinners, heparin. It was not possible to have an implant done on them. Numerous cases of diabetes patients as well as patients taking blood pressure medicine are and have been done by Dr. Irfan Motiwala in Hyderabad, and the patients are doing fine. There is no problem at all. Age limit, again, there is no age limit. It depends upon the bone thickness on which the implant fits. This present technique which they are speaking of, they are speaking of it in a greater detail, being the specialist. This allows to be done on the thinnest of jaw bones available. Even for a thickness of 2 mm, they are capable of doing it. They have their own method of doing it, which they'll again explain it to you.